as we enjoy, forget in time that men and women have died to win them. That's the significance of Memorial Day. In a word, sacrifice. And while we noted the void left where our race weekend would have been, we also honored the void left by the brave men and women who gave their lives so that others might live. What many don't realize is that this famous quote from President Roosevelt was not delivered in a speech. It was part of a presidential proclamation honoring the adoption of our Bill of Rights. In his proclamation, President Roosevelt challenged the country to engage in the remembrance of the democratic and peaceful action by which these rights were gained, and to set aside a day of reassessment of their present meaning and their living worth. On Memorial Day, we honor the sacrifice that promotes liberty. So before we get into today's announcement, I want to take a moment to recognize something. The tension that exists between those two ideals, sacrifice and liberty. And that tension has never been more apparent. But today, as we take another small step toward our city's return to normalcy, I want to acknowledge that amidst all of this uncertainty, I am confident that the history books will remember this time as a time in which our city came together to sacrifice for the common good. I'm also confident that our commitment to a data-driven public health policy has saved lives. For that reason, we will be taking another step forward in Marion County, implementing many of the aspects of Stage 3 of the Back on Track plan. Effective Friday, May 29, houses of worship can resume indoor service at 50% capacity, providing congregants engage in social distancing and wear face coverings. And there will be no cap on outdoor services that are socially distanced. That is effective May 29. I'll name a few more policies and then let Dr. Virginia Kane get into the specifics. Effective June 1, the cap on public gatherings will be increased to 50 individuals. Restaurants may serve indoors and outdoors at 50% of their total capacity, so long as social distancing policies remain in effect and staff wear PPEs. Personal service industries may resume by appointment only with PPE worn by all staff and all patrons. Now, this includes salons, spas, and tattoo parlors. Gyms and fitness centers may open at 50% capacity with social distancing and sanitation requirements. Tennis courts, basketball courts, and non-contact sports fields may reopen. Pools may reopen at 50% capacity. If these facilities are indoors, face coverings for staff will be mandatory. Additionally, shopping malls and non-essential retail can increase to 75% capacity with the same restrictions around social distancing. In accordance with state guidance, We will not be opening movie theaters, live performance venues, tourism, and cultural events and venues. Bowling alleys, arcades, or bars remain closed. Many more details can be found in the Marion County Public Health Department's forthcoming order. So before I turn it over to my partner, Dr. Virginia Kane, I want to reiterate something that has been said during our previous updates, but it cannot be stressed enough. The very best way you can protect others from COVID-19 is by wearing a face covering while in public. When you see someone with a mask, they aren't wearing it for themselves. They're wearing it for you. It is why from the start, our message has been simple. We are in this together, but only if we commit to protecting one another when we take these first steps back into a daily normal routine. And to those who disagree with the science or the style of wearing masks in public, I have an even simpler message. You're simply wrong. We just had a day reminding us all what true heroism is. This is a small task by comparison, and it is a small ask by comparison. But I also recognize that masks may be difficult to access. That's why we're kicking off a citywide initiative to ensure that every Indianapolis resident has free, easy access to obtain a mask. This morning, we launched indy.gov/masks. That's indy-masks. That's indy.gov/masks, where you can request washable, reusable masks for you and for your family. It is our hope to begin delivering them within the next 30 days. We will soon be announcing community partnerships that will include pickup locations throughout and across our city. We've earned these steps to reopen. But now we must do our part to keep Indianapolis open. So get a mask and wear a mask. This Memorial Day weekend, we were given a stark reminder of why we take these precautions. Throughout our city, throughout our state, throughout our nation. Our nation's flag flew at half staff to memorialize an unprecedented 100,000 Americans who have lost their lives to COVID-19. That is a staggering number, especially considering all the precautions we've taken. But there is reason to hope, and working together, we will get through this. We will get through this. As always, I'm joined today by Dr. Virginia Kane, Director of the Virginia Kane, Director of the Marion County Department of Public Health, and I am pleased to hand it over to her for her perspectives and more information. Dr. Kane.
Thank you, Mayor. Thank you, Mayor Hogsett. And let me just say again, that this COVID disease outbreak will continue to remain in our communities unless we are responsible stewards. And I just want to applaud you again, your team and your staff and your leadership in helping to keep Indianapolis safe. And I just want to highlight just a few numbers in terms of where we are in regard to this outbreak. So in order to really have a safe summer, Excellent. In order to have a safe summer, one second here. I'm having a little technical difficulties for me to see the screen.
All right, we'll be right back.
News 8 and 93 WIBC working together to bring you more local news.
Oh my gosh. Wow. Who am I? Wow, is that really me?
They are on social media, those videos claiming to instantly get rid of bags under your eyes.
Well, now you can see it work for yourself this Memorial Day and feel and look your best.
It's called Plexiderm, and lifestyle expert Annette Figueroa is here to tell us why she says this one is for real.
This one is for real, and I'm so excited. We even have a video that the viewers can watch while you and I talk. And you'll notice the model has bags underneath his eyes and some sagging, and all he uses is a small amount, and that's how easy it is.
All right, what's the active ingredient?
Okay, so it's silicates that are minerals found in shale rock. And what it does is it tightens and lifts the appearance of bags underneath your eyes in as little as 10 minutes, no prescriptions, and...
Okay. So when we look in Marion County, we have roughly 9,628 cases of the entire state of Indiana. That represents roughly 1/3 of all the COVID-19 cases. We have reached a point of 539 deaths, and we have really expanded our testing just in the last weeks, where we've tested now 50,000 of our residents. if we wanted to see how we track in the United States, the progress we're making as states, this map highlights those states that are making progress to the new norm. And if you will see here, those states that are highlighted red are trending very poorly in regard to the numbers. But when you look at Indiana and its surrounding states, in the states in the yellow, you will see that we're making a significant progress based on criteria that has been set up from the national government. And the only states that have trended significantly, doing extremely well, is New York and New Mexico. Next slide. So it's been a tough issue trying to assure the health and well-being of the residents in Marion County, but at the same time trying to balance that very hard, the economic hardships that are going through different families and the businesses related to our phased approach. So just remind everyone, we have different benchmarks that we look in terms of whether we're making significant progress. And that is, have we seen a reduction in our community transmission for the last 14 days? Are our hospitals and long-term care facilities able to meet any emergency surge of care if we should see a peak in our cases, and then our ability to provide sufficient testing and do contact tracing in terms of monitoring our cases. Next slide. So one of the things we look at our decrease in our emergency room visits, we look at our decrease in our hospitalizations, looking at our death rates, and whether the percent of the people that we're testing, what percentage of them are positive, and are those numbers going down lower? So this slide highlights that from April the 1st through May the 22nd, looking at our emergency room visits, and these are just residents and patients who have COVID-19 symptoms only, no influenza, you can see that we continue to have a downward trend through May the 20th. When we look at our new cases for COVID-19, you're going to see an increase of cases with expanded testing. And as you see around when we start to see our rise, the last week in April, April the 29th, where we saw a huge peak going up and into our first week in May, but you now see the gradual decrease in our number of cases, so that right now we seem to be roughly under the 150 cases a day mark, whereas 2 weeks ago, we were averaging over 200 cases a day. So significant reduction in our cases. When we look at our hospital admission, which is really critical, you will see that our hospital admissions have significantly decreased since early April in terms of the patients who were positive for our hospital admissions. Excellent. Now, when we also look at our deaths, when we saw our largest number of cases in that last week of April, first week of May, we are starting to see a significant reduction in the number of deaths that have occurred since that period of time. Next slide. But probably one of the most important factors that we monitor is that we're continuing to see a decrease in the number of people that we tested turning out to have a positive COVID-19 test. So that continues to be on the decline. Do we have sufficient capacity? Currently right now, for all of our medical and surgical beds, we're at a 88% occupancy. So our hospitals and our healthcare systems appear to be well equipped to handle any potential surge that may occur as we're going through our reopening phase. So the most other and final critical component that we really need to continue to push is really having the ability for our community to be able to test people who have COVID-19 symptoms. We've had a number of enormous partners out there who have expanded our testing. And we've got some new partners out there that we started last week. We want to thank Warren Central High School for a new site last week, as well as the Indianapolis Motor Speedway, who's allowed us to have another site, and our Indianapolis Medical Society and Escalapia Medical Society, who have continued to be new partners supporting this new endeavor. Besides Kroger's really coming out front in providing additional testing, and Walmart has also provided 3 additional sites for testing, and the Indiana State Department of Health continues to add new sites for testing. So we're feeling pretty good that we're going to be meeting our benchmarks for the ability to test people who have COVID-19 symptoms, especially for our vulnerable populations, as well as continuing to conduct active case monitoring and contact tracing. So, as the mayor has emphasized, and following along with the governor's mandate and following his recommendations, we've moved into phase 3, and we're now able to open our retail and malls at 75% capacity with social distancing, with the mall's common area limited to 50% capacity. Salons, spas, tattoo parlors may be open by appointment only, but clearly you must recognize that not only the employees and patrons, both are required to wear face coverings. Both, not just the employee staff, but the patrons as well. Our restaurants can now open indoor seating as long as it's split between any indoor and outdoor seating at 50% capacity. It's so important that our religious services may now be able to resume at 50% capacity, where any participant within the church is mandatory to wear face coverings for indoor services unless you have a little child that's 2 years and under. No mask are required, but outdoor services can be held with no capacity limit. Gyms and fitness centers may open at 50% capacity. You may have some additional recommendations, such that your equipment must be at least 10 feet apart when providing personal services to clients in your facilities, but no contact sports are allowed. Basketball, tennis courts, sports fields, swimming pools can open at 50% capacity. And please, practice and conditioning may resume, but for only non-contact sports only. It is so important for people to be able to get back to work, and we are would like to open up daycare facilities. Summer day camps can occur, but no overnight camp is allowed. But YMCA programs, adult day service programs can open with social distancing. Campgrounds may open, but any on-site playground facilities must remain closed. And then lastly, raceways may open currently, but no spectators are allowed at this time. And lastly, really critical, non-essential manufacturing and industrial facilities will also be able to be open as long as social distancing and face coverings are initiated. And so with that, let me just say and I will reemphasize what the Mayor Hogsett has stated, that the ability for us to get to our new normal, to bring this vibrant city and continue to emphasize how wonderful a city it is for our community, that we really want to encourage everyone, please wear a face covering while in public. Continue to do your personal things that you can do in order to protect yourself and your loved ones with frequent hand washing. Maintain that 6 feet distance between yourself and others, and really try to encourage social distancing practices among your colleagues, your friends, and family members. Public gatherings are limited to 50 people or fewer, but high-risk individuals, if you're immunocompromised, if you have any age, significant medical underlying conditions, and those over the age of 65, we really would like for you to encourage you to stay at home as much as possible. And businesses out there, continue to do remote working as much as possible in order to continue your business endeavors. It's only if we're able to continue to be vigilant, even with these ease restrictions, we will be hitting a home run. And so I just want to thank again Mayor Hogsett for your leadership. I want to thank all of our partners as we are pushing to do contact tracing with the city, Fairbanks School of Public Health, and the Indiana State Department of Health, and my epidemiology and infectious disease, communicable disease team at our health department. We have a significant number of partners, different agencies that will continue to help us. And so stay safe out there, okay? And do the right thing. Be patriotic. Thank you, Mayor.
Thank you, Dr. Kane. We will open it up to questions. If you enter your name and outlet in the Q&A box, we will call on you and unmute your microphone in order to allow you to answer your question. The first one up for the second time today is Russ McQuaid from Fox 59.
And good morning, Dr. Kane. Yesterday, the CDC came out and said antibody testing at best is perhaps 50% accurate. I'm wondering, what is the Public Health Department's reliance on antibody tracing results to track the positivity rate in Marion County? So,
Russ, let me just say that for us, it's more critical and important for us to know whether I have an active infection versus I'm able to determine whether I ever had COVID testing back in, say, January or February. Because these tests are not as at the level of accuracy that we like, our health department is continuing to use testing for the actual virus antigen itself, where we're concentrating, because I really need to know where our active infection is. I'm less concerned about past infections, so that I can really concentrate on contact tracing, trying to identify the last 14 days of that person's interactions with other people where they may have spread infections. So right now we're just focusing on active antigen or viral particle detection as opposed to antibody testing.
Eric Berman, WIBC.
How about now?
There you go.
Yeah. Apparently you need to change the mouse click rate. Mr. Mayor, good morning. Question and a clarification. this diverges slightly from the state order in terms of the cap on mass gatherings being at just 50 instead of 100. You're also not going quite as far as the state on houses of worship. What's the rationale for keeping those lower limits in place? And the clarification, did I understand Dr. Kane to say that conditioning drills are not allowed for contact sports? Not just contact sports, but the conditioning drills for them?
So, who's going first, Mayor? You are.
Go ahead, Doctor.
So for the contact sports, you can do conditioning, but let's just say you play football, and you're out there. And just so you know, I was a former football player in the undergraduate school. You cannot, in your practicing and your drills, you can't tackle another individual where you have physical contact. But you know how you can have practice, as long as you do your practices and your drills, and you're not touching another player, that's fine from a conditioning standpoint. Ladies can be very brutal when they play contact sports, just so you may know.
And Eric, I just simply add regarding the first part of your question, what is driving Marion County and our now opening up to the beginning of stage 3 is, as Dr. Kane has analyzed in detail in her presentation, and that is we still in Marion County, as well as we are doing, as good as everybody is responding to the requests that we are making, we still, as a percentage, have 30% of the total number of presumptive positive coronavirus diagnosis, 30% of the overall state number, and we're a little under 30% now, but just barely under 30% of the total number of tragic COVID-19 related deaths. And Eric, when you consider that the total population of the city of Indianapolis is approximately 12 to 13% of the total population of the state of Indiana, and yet we're experiencing 30% of the presumptive positive cases and the COVID-19 related deaths, I think in no small measure, and I don't mean to speak for Dr. Kane and her public health staff, but from my perspective, Indianapolis is moving forward cautiously, appropriately, responsibly, given how disproportionately affected the city of Indianapolis has been by the COVID-19 pandemic. Dr. Kane, you want to add?
So I just want to add that when you look at Marion County compared to the rest of the state, we just have a much higher population density. So because of our higher population density, it makes it easier for our risk for spreading contagious diseases much greater than if you look at the state of Indiana as a whole. And so just with an abundance of caution, we want to really get a feel for how well we're doing as we're reopening up Marion County to our different business and other civic endeavors, where we can watch this very closely. And it takes about 3 to 4 weeks for you to see your impact. And even if we see some rises in our cases, we want those rises to be so low that we don't have to shut down everything, where we can handle a little rise in cases, and that's fine. And that may be even a slight expectation for a large metropolitan city, but we don't want to go backwards. And so just an abundance of caution, we want this to sort of be a little gradual phase because we're different. We're unique than most any other cities in the state of Indiana.
Abdul Hakim Shabazz, in politics.
Good afternoon, Mr. Mayor. Mr. Mayor, can you hear me?
Yes, we can, Abdul.
All right, great. My question was two things. Number one, what was the logic behind closing that Monument Circle. I could see Illinois Street with the restaurants, but Monument Circle, there's had a lot of people confused as to why was that. Well, even though DPW has said it'll reopen. And number two, when do bars get to reopen in Marion County? Because I know there's a lot of concern about folks on one side of Raceway Drive or 96th Street can't open, but the places across the street in Hendricks and Hamilton County actually can.
Yeah, as it relates to question one, we are making an adjustment on Monument Circle because of traffic-related issues that came up over the course of the last weekend. And this was a request made of us by Downtown Indy. So we're trying to be as responsive to not only patrons who access Monument Circle, the retail outlets that inhabit Monument Circle, but also traffic patterns and requests from our stakeholders and partners. And in this case, it was Downtown Indy. As to the second question, you want to repeat it, Abdul?
When do bars? Sure. When do bars get to reopen? Because I've been heard some concern about bars on, say, south of 96th Street or one side of Raceway Drive are closed, but across the street they're open.
Yeah, I think the simple answer to your question, Abdul, is bar reopening is, if I am accurate in my recollection, a stage 4 or a phase 4 issue. And today we're announcing essentially that Marion County is attempting to very cautiously and responsibly enter stage 3. Anything in addition, Doctor?
No, that's correct. So based on the governor's back to Indiana track, stage 3, all bars and nightclubs are closed for stage 3. So we're not allowed to be less strict than the governor's recommendations and guidelines.
Dr. Kane, it might be helpful if you could explain the aerosolized nature of the virus and why sometimes bars might be, at this moment, a dangerous place for us to reopen so quickly.
So one of the issues with the bars is that you, based on people speaking and talking and interaction, you may have a higher quantity of respiratory droplets in an enclosed environment with the bars. And so as a result of that, they're considered at a much higher risk based on their contact density of contagious respiratory droplets interacting with other individuals. And based on that science and that evidence, most governmental entities are having those particular businesses be sort of at the last part of the phase in terms of reopening for the community, in terms of proximity and the amount of the virus to spread in their environment from folks who interact at a bar.
And Dr. Kane, isn't it correct that statewide bars should be closed until stage 4?
Yes, that is correct. So there should not be any bar or nightclub open in the state of Indiana.
Great. We have David Williams from Wish TV.
Good morning, everyone. Across the country, experts are watching and warning about a possible second wave or resurgence as all states begin to reopen now, and counties as well. Is Marion County prepared to possibly handle a second wave of coronavirus if we reopen?
So, yes, let me just say that we meet on a regular basis with our hospital partners, all of our hospital partners, and we try to meet on a weekly basis. So we're very careful, and the hospital systems and healthcare systems are very careful about how many medical and surgical beds they have, how many ventilators, if that's required in order to meet the demand. And so you also have to remember back in February, March, and April, we were having the influenza season going along at the same time we were having the COVID-19. Now that our influenza season has dramatically dropped and less significant, that frees up a lot of beds for us, at least going all the way through fall. So we're now in the phase of actually having elective surgeries taking place in our hospital systems, but our hospital partners are being very cautious. They're doing that on a gradual basis to make sure that if we did have another significant surge of cases, we should be well equipped in order to handle any kind of surge from a capacity standpoint.
And David, I would just simply add to what Dr. Kane has emphasized in her presentation. That is the issue of a resurgence is of paramount importance to all of us. And that is why we are prioritizing more testing, the contact tracing, standing up as best we can, as quickly and as responsibly as we can, and then frankly working with our partners on new treatment methodologies or protocols. But if you have robust testing and if you have contact tracing, it is much easier to contain any kind of resurgence that we may experience. So that's why, as Dr. Kane emphasized, the tracing and the testing are critically important.
Erica Irish, State House Files.
Hello.
Hi, Erica.
Hi, good afternoon. Hey, good afternoon, Mayor and Dr. Kane. Thank you for taking my question. I just wanted to ask a little bit more about the mask initiative. What costs are attached to that, and from where is the city obtaining the supply of masks?
Yeah, in terms of the cost, Erica, the cost is unknown at this point in no small measure because we don't know what the nature and the volume of the requests will be. I would not be surprised if it was in the area of perhaps $1 million. As to where we're obtaining the masks, I want to default to Paul Babcock, and he can provide elucidation there.
Yeah, sir. Thank you. So, Erica, we're getting the masks from a U.S.-based supplier. That hasn't been finalized exactly, so I would be remiss to give you the information of exactly where, and then it changes over the next, 48 hours, just because of trying to negotiate the best price for the city, as well as making sure we get access to the masks in a way that we can supply the volume to our residents here in Marion County.
Wonderful. Thank you all for joining us. We'll be following up with a press release and documentation later this afternoon. Thank you.